Hello, my name is Renee McMahon, and I would like to share with you my presentation on alcoholism among women. In order to describe alcoholism or alcohol addiction to you, I've decided to use the DSM-5, which is often used when diagnosing clients with alcoholism. The following slides will list the total symptoms of alcoholism and substance abuse according to the DSM-5, and there are different levels of alcoholism. If a person experiences 2 to 3 symptoms, it indicates mild alcoholism. If a person is experiencing 4 to 5 symptoms, this may indicate moderate alcoholism. And a person showing 6 or more symptoms on the next slide indicates a severe alcoholism. So, according to the DSM-5 and the American Psychiatric Association, these are some of the symptoms that may be prevalent in a person's life who is experiencing alcoholism. I have highlighted in red the most profound words listed in the DSM-5 that indicate symptoms of alcoholism. So they can either take alcohol in larger amounts than was intended. There can be unsuccessful efforts to cut down. A great deal of time may be spent used trying to get alcohol, use alcohol, or recover from its effects, such as hangovers. A person with alcoholism also experiences cravings. They may begin to fail to fulfill major roles or obligations at work, school, or home. They may continue alcohol use despite having recurrent social or interpersonal problems. A person may give up activities that they once enjoyed or reduce doing these types of activities because of their alcohol use. A person experiencing alcoholism may also have recurrent alcohol use in situations in which it's physically hazardous, such as DUIs, endangering your children because of your substance or alcohol abuse. Number 9 indicates that alcohol use is continued despite recurrent physical or psychological problems that are exacerbated by alcohol. Number 10 is a tolerance is developed for alcohol. A person may need to drink more and more and more in order to even feel the effects that they're trying to reach from alcohol. And lastly, they list withdrawal, which can be physical withdrawal from alcohol. According to the National Institute of Alcoholism and Alcohol Abuse, about 7.2% of Americans 18 and older have experienced alcoholism on some level in 2012. So that is about 17 million people experiencing alcoholism on some level within the year 2012. This same government organization reports that 5.7 million women experienced alcoholism on some level in the year 2012. 4.6% of adult women aged 18 and older experienced alcoholism on some level in 2012. So approximately 34% of people experiencing alcoholism in 2012 were women. So about 1/3 of people experiencing alcoholism are women. So the other 2/3 would be men. So let's start looking at some of the determinants of alcoholism among women and some of the literature that I've reviewed. First, I came across social networks being a determinant of alcoholism among women. Research found that friends and family of women who have high levels of drinking have influenced women's drinking as well. It also noted that if a woman's husband is potentially an alcoholic, his drinking patterns may also influence the woman's drinking patterns, therefore leading her to drinking at levels that would continue on to indicate that she has an alcohol abuse problem. So the second determinant that I've decided to include in my web of causation and review in literature was trauma. And the research that I found stated that women who are survivors of physical, sexual, and psychological abuse experience considerably higher rates of alcoholism than women in the overall population. So unfortunately, women who are physically, sexually, and psychologically abused seem to be turning to alcohol as a means of coping with their trauma. Okay, on this slide, I'm going to review 2 determinants that I have included. First would be family history. I reviewed the Oklahoma Family Health Patterns Project that conducted a study to evaluate how family history and early life adversity influences alcoholism among women. And the findings have shown that women who experience alcoholism in their family in early life, along with adversity, experience an influence on their personality and behaviors that puts them at risk for alcoholism and substance abuse in later life. So this is a social influence on these women and their later life behaviors. The next thing on this slide I've decided to discuss is age. I found a study that was done on alcohol abuse and dependence and its correlation with early onset alcohol use. So the findings pretty much said that the younger a woman is when she takes her first drink, the more likely she is to develop alcoholism or an alcohol use disorder. The study also focused on the cumulative impact that several risk factors may have on alcoholism among women, which I found really interesting because that's pretty much what we're doing in this project is discussing the web of causation and how they all interconnect and, may influence a disease later on in life. The fifth determinant that I've decided to review for this presentation is depression and how it influences alcoholism among women. I found a study that focused on sex differences, and it determined that women are more likely to have symptoms of depression, which can increase cravings for alcohol among alcoholic women. A diagnosis of a mood disorder, anxiety disorder, or depression are found to be more prominent in female alcoholics than in their male counterparts. So males may not experience these psychological disorders, whereas females tend to experience them more often as alcoholics. So finally, we're at my web of causation conceptual model and how all 5 of these determinants may lead to alcoholism among women and also interact with one another. So here I've shown that family history can be linked with depression biologically, or because of social situations growing up in a woman's life. Family history can also be tied to trauma. A woman may have experienced trauma in her life due to her family history. Family history is also influences social networks. A woman's family may be very influential as part of her social networks as an older adult. And I've linked age along with social networks. So let's say at a very young age, a woman is interacting with other young peers who are drinking. This may influence her early onset drinking as well. And I've also linked age and trauma. Early childhood trauma definitely influences a woman and may affect her becoming an alcoholic later in life. And then I have depression and trauma linked to one another. Trauma may lead to depression later in life, which may lead to alcoholism later in life as well. So as we can see, all 5 of these determinants can intercorrelate with one another and can also all be directly linked to alcoholism among women. So now let's look at alcoholism among women from a social work perspective. I found a journal article named Genetics of Alcohol Dependence and Social Work Research. Do they mix? As shown in my web of causation model, family history plays a role in alcoholism among women. I approached family history as a social influence, but it's also been proven as a biological influence in the form of genetics. I didn't approach this in my web of causation conceptual model because I found genetics very hard to understand, which will lead me to what this article had to say about social work practice. As we all know, social work practice emphasizes a biopsychosocial approach to social issues such as alcoholism among women. And the field of social work to date has not conducted many studies involving genetics, yet we know that they are linked to alcoholism. The approach of this article suggests that social workers work in an interdisciplinary research team, and social workers should reach out and collaborate with geneticists to better understand alcoholism in order to develop new treatment options and interventions for their clients. So to sum this up, I've put genetics plus environment equals better prevention and treatment plans. Now let's look at another social work perspective that I've found with a journal article titled Women and Alcoholism, How a Male as Norm Bias Affects Research, Assessment, and Treatment. The perspective of this article suggests using a woman's health perspective for the assessment, treatment, and recovery of female alcoholics. Typically in the assessment phase, today people use frequency, prevalence, and consequences of drinking to diagnose alcoholism. And this is usually based on males. So these numbers are based on how certain quantities of alcohol affect a man's body, not a woman's body. Women's bodies are, in general, smaller, and they process alcohol differently than male bodies do. And also the consequences of drinking for men tend to be more behavioral, where women report to have more interpersonal problems, which are not usually addressed in typical assessments. Next, the journal article approached treatment from a women's health perspective. Alcoholic women tend to have different experiences and needs that need to be addressed in treatment, such as abuse, as mentioned earlier, trauma, and child care. Group sessions with both men and women present may affect what information a woman is willing to share. The article also suggested that men are more likely to interrupt in these type of group meetings. So this approach suggests that treatment should remove these type of barriers and address sex differences, abuse, and most importantly, child care for those women that have children. Lastly, this article approached alcoholism among women and recovery. The article discussed a different approach to traditional recovery programs. For instance, Alcoholics Anonymous remains to be one of the most popular recovery programs used by alcoholics. AA was developed and designed for males and by males, and the Alcoholics Anonymous book can tend to use some sexist language. This article suggests that applying its ideals to women may be counterproductive because AA promotes submission to your addiction and a disease. Males may benefit from this idea because they're in more of a power position, so becoming submissive to their addiction may help them move through the addiction. But as this article suggests, that women need more empowerment over alcoholism and their addiction in a culture where women are the subordinate gender. So speaking of AA, I've decided to focus my community-based responses on Alcoholics Anonymous. I found an article titled 12-Step Interventions and Mutual Support Programs for Substance Abuse Disorders, an overview. So this article discusses how the most popular 12-step program used to help in the recovery of alcohol use is Alcoholics Anonymous. These programs are designed for the use of anyone facing an alcohol or substance use disorder. They are widespread and they are free of charge. In 2012, Alcoholics Anonymous reported having 64,000 groups nationwide and in Canada with 1.4 million members. The goal of Alcoholics Anonymous is to lead people towards the acceptance of their addiction while growing in maturity, spirituality, and also helping others who suffer from addiction and alcoholism. Continuing on with Alcoholics Anonymous as a community-based response, the components of Alcoholics Anonymous are pretty much its 12 steps. It is a 12-step program. The 12 steps can be viewed by following this link. I thought it might be a bit lengthy to incorporate all the 12 steps in this presentation, but feel free to follow this link in order to view the 12 steps of Alcoholics Anonymous. Alcoholics Anonymous also encourages its members to not drink, to attend meetings, to obtain a sponsor, and also to remain active in the Alcoholics Anonymous community. Cross-lagged analysis and longitudinal data have shown that the more that a person with an alcohol abuse problem attends AA meetings, the lower they subsequently abuse alcohol. So the more you go to meetings, the less likely you are to drink. What I really enjoyed about this article was that it included special considerations for women. So it reminded social workers of the special considerations when working with women. Women make up 1/3 of Alcoholics Anonymous members, so this is very close to the total ratio of women who are alcoholics compared to the total number of reported alcoholics. And many AA groups do offer women-only groups. as suggested earlier from this presentation, that women may benefit from women-only groups so they don't feel as though they need to guard their words or what they share within the group setting because of the presence of men. So, in conclusion of my project on alcoholism among women, I'd like to discuss how the DSM-5 provides practitioners with a great medical model to diagnose alcoholism or alcohol abuse. Women experiencing alcoholism make up about 30% of all people experiencing alcoholism. As far as the determinants of alcoholism among women, I discuss social networks, trauma, family history, age, and depression. Practicing social workers should consider working with interdisciplinary teams in order to best understand the role of genetics, yet another determinant of alcoholism among women, but not very researched by the social work field. Also, social workers should remain mindful about the special consideration faced by women alcoholics as compared to men alcoholics. Lastly, I discussed Alcoholics Anonymous as a community-based response, and it provides social workers with an effective program that's widespread, free, and provides women-only support groups. This is a great program for social workers to be familiar with if ever faced working with a woman experiencing alcoholism. Thank you for listening to my presentation, and I hope you found it very informative.